games, drink a beer. The whole illness process changed my life. And as a result, I had to start looking, researching for myself, ways in which to get back to normal health. So I pursued, among other things, the idea of the ozone treatments. And it wasn't something that you could get here in Canada. Within hours of having the first treatment, I started to feel a sense of wellness. And I started to feel my ill health turn around. It was a very long, slow process. But the only intervening factor at the time of the change in my health was the ozone treatments. I certainly, for one, am very, very grateful. It brought my life back. And for those people that think it's quackery or madcap medicine, or wait till you're sick and allopathic medicine, regular medicine has done everything it can for you and you've got nothing left, maybe then you might want to consider trying ozone.
And about 6 years ago, I became severely ill. I had fever for a year and severe arthritis. And eventually I was told that the only treatment given would be steroids, and that also possibly may not help. So really it was oxygen ozone therapy that saved my life, you could say. When I returned to England from Germany, I resolved to introduce this treatment in England. I've been using this now for 5 years. It's the main treatment in the center. I do 4,000 to 5,000 ozones every year. So it's my major work, really. And I see a variety of, or people with variety of illnesses, ranging from influenza to cancer and HIV.
Sarah Butson has suffered from hepatitis C for 20 years. She chose a small clinic in Tijuana, Mexico for treatment.
I have a background in biochemistry and genetics at a master's level. My initial pre-test or pre-treatment viral count was close to 2 million. At the end of treatment, after 30 days, my viral load had gone down to 12,000. I had never felt such health. I don't even know if I'd felt that healthy any time previously in my life either.
At hepatitis, for example, I think there's a lot of reason to be optimistic. Optimistic with a disease that otherwise is still a challenge to modern medicine. And if you add to the equation the fact that not only do we not have treatments that are truly efficacious, but we don't have treatments that are affordable either. And we have increasing insights into a disease like that the mortality rate and the morbidity is enormous. That's why I'm here, is the fact that even if only 10% of what's being said out there is correct, that's enough for me. The healthcare system right now is in serious trouble.
I think that a lot of people are dying needlessly because of government policies. And that's one reason why a lot of people are doing self-treatment. That's why they're going to Germany and going to Cuba and going to Mexico, because they can't get treatment for their diseases here in the United States.
I think it's terrible. Why do American citizens have to resort to travel to Mexico, to Germany, to the Bahamas, and spend their life savings to try to get a treatment? My T cells were down to like 30. I was having fatigue, loss of appetite, intermittent fevers and night sweats, and I turned to conventional medicine, AZT, prophylactics for pneumocystis pneumonia, CMV. I was prophylacting on about 5 medications, and I had a very, very quick deterioration. And my body repelled them. I stopped. And since I have began the ozone therapy, I feel phenomenal. I'm as strong as an ox. But what is my alternative? AZT, DDI, DDC, nucleoside analogs that I have been on. And I wanted to jump out of a window. I had such severe headaches all the time, and I was emaciating because I couldn't eat. I would want to throw up by just smelling food. And these were all caused by the medications which the conventional medical establishment is using to supposedly combat this
Basically,
disease.
I use ozone to detoxify liver. If I'm preparing for a film, I do IV drips, and I'll also do maybe 2 or 3 days later an ozone injection. Also, I have a herpes condition that usually breaks out from nervous tension. It'll break out in cold sores. I can totally avoid that with ozone.
There's approximately 50 million people in the world with HIV, and there's 300 million with hepatitis C and another 200 million with hepatitis B. We all need to recognize that the world is under a viral affront right now like it has never experienced before, and it's getting worse. And we need inexpensive solutions. And Medozone is an inexpensive, very effective, non-toxic
Drugs
solution.
do help countless people, but there are also the side effects. In 1998, the Journal of the American Medical Association reported serious adverse drug reactions with 2.2 million patients, resulting in 106,000 deaths, making pharmaceuticals themselves the 5th leading cause of death in the United States.
You know what it's going to take is the fact that conventional medical modalities are bankrupting the country. That's what it's going to take. Because I can go in with ozone and I can treat at a fraction of a cost the same diseases these guys are treating with medications.
They can't make any money on it. The problem with America is it's an economic-based country. How would the pharmaceutical companies make money out of ozone?
In 2001, in the United States alone, $154 billion were spent on prescription drugs. Profit margins are some of the highest of any industry. The resulting influence on the medical world is profound.
Through grants and through advertising, they basically control every medical institution there is, from the American Heart Association to the Journal of the American Medical Association to any medical journal to virtually any continuing education conference you're going to go to. If it's put on by a university in little tiny letters down there, you're going to find out that it was a huge grant was given by a pharmaceutical industry. No question about it.
In the FDA, drug companies have representatives on nearly all the committees. If there's something which may undersell the average drug company, of course they're not going to be very pleased if that gets developed. It might be very difficult for them to compete with that.
Nobody in the pharmaceutical industry can sell ozone. That's a main reason. When we can find a way to sell ozone, I'm sure that ozone is the most important drug in the world.
It's not a problem of money, it's not a problem of business, it's a problem of the health of a human being.
Eventually they will have to open their eyes and see the light and analyze this as a potential therapy. But until then, lots of people are going to die.